I've seen a couple of comments on social media talking about setting up private practice, that there is a or potentially huge financial barrier. Throw over to our expert, Dr. Matthew Wickham. Matthew, so thank you for, being very un-British and sharing your finances. Go on, how much does it cost to do this?
Not as much as you think. I think is probably the simplest answer in a nutshell.
Okay.
The reality is, I actually talk about this in my webinar every month on setting up private practice. So this isn't something that I've never said before. This is definitely something that comes out every month to anybody who wants to join. But essentially, I managed to do it for about £4,000.
Wow.
Which was not breaking the bank.
Can we break down those costs? Sort of where did that figure come from?
The costs can be broken down. So I initially wanted just to start quite small.
Okay.
And I just rented a room for one session or a half day per week, because I didn't have any patients when I started. So I didn't want to sign a contract saying, oh, look, I'll pay, thousands of pounds a month for something I wasn't sure I was going to be doing a lot of. So I did that, £85 a session.
Okay.
And I even negotiated it. I absolutely negotiated this to the letter and said if I didn't have any patients booked in, I didn't have to pay.
Wow. Okay. Were they quite agreeable to that, or was it just down to negotiation?
I negotiated that. I was like, I really don't want to have to pay every week if I only have patients for 2 weeks of the month for whatever reason.
Makes sense. That's brilliant. Yeah. Okay. So you've already saved a huge, because I know we've touched on previous videos that sort of like rent is going to clearly going to be one of your highest costs in terms of consistent outgoing. So the fact that you've negotiated and saying like, look, I've not got anyone booked in, I'm not coming in, can I not pay? And they said yes. But I take it then from, you've set this up for a couple of years now. So actually the longevity argument that you're a good customer, for want of a better description, is probably your counter sort of negotiation. Yes.
And you're also, I was working under practicing privileges to do this. So actually just being somebody that they could trust and work alongside was actually just as valuable. So the negotiation was relatively amicable. There was a win for the person as well as for me. Equipment, you do need some equipment. I negotiated in the room rental that it had chairs and an examination couch, or a big chair for me anyway, a chair that I need for doing the things I do with ENT wise. I also negotiated clinical waste was included in that as well. So there are things you definitely negotiate everything, right? If you're going to talk about costs, negotiate everything.
I think this is stuff that for me, like I know my practice manager, this is the stuff she dives into. So like even now, clinical waste, you've mentioned recycling that you have to do, or it will soon become a legal requirement, even going down to, as you said, you've got like equipment for a decent office chair, table, etc. They're not cheap. So the fact that you got those negotiated in, absolutely hats off. Yeah.
And it includes your, heating as well. Heating and lighting, everything
brilliant.
That has to be included is there. So negotiate is the definite word of the day there. I needed some specialist equipment, so that ramped up my costs. In fact, the majority of my startup costs about $2,500 were just on equipment. That was things like a headlight microscope and suction machines and consumables that I actually use to do the job I do. If you're going to be taking bloods, which is quite a common thing for people to do.
Yes. Yep.
Then you're going to need to be signed up as a person who works alongside a private laboratory to do those blood tests.
Understood.
Makes sense. So you become the customer of the lab. So they want a float. So there was a £500 float. Is that to stump up front because they want to know they're getting paid to do the blood tests. I don't actually use Randox anymore, but that was what I used at the start. There are other labs available. We talk about that in the webinar for sure. And you're going to need some form of electronic patient record. And that's probably the key bit because you're going to have to safely store information about your patients, and you probably want to integrate it with a lab like Randox or one of the other ones like TDL, etc. And so that you can actually get the results back and be able to, answer the questions that you need to answer for your patients. Assemble's one of the more expensive electronic patient records privately. They used to call it HADOC. roughly around £215 a month now. It's gone up slightly since I started. It was 210 on the first month. But you can get other ones, and we talk about them in the webinar. You can get ones that are actually a lot less expensive, but I don't think they're as interactively nice to work with. So for ease of use and functionality, I think Semble, it does a pretty good job. I needed a website. I needed a logo and a bit of branding and some business cards, that kind of thing. That was about £500. And I did a little bit of online marketing with a membership for Tongue Tie Association. So I'm a member of the Tongue Tie Association.
Fine, it makes sense.
Tongue ties in my private practice, which they don't do in the NHS as much. So it worked out as quite a nice way. So there was a little bit for that. And in total, it was about £4,000. So it wasn't too bad. The one cost that I would say everyone has to look at is their indemnity. You're going to have a different level of indemnity, and that is variable. Depends on who you are, what you do, where you work, how much you're doing, and what other things you do alongside it. So it's almost impossible to kind of say what that would be for anyone, but you can get some quotes quite quickly for that. To cut a long story short about indemnity, my indemnity went down as I increased my sessions from GP work in the NHS to private practice. You're not seeing as much acute stuff. I'm also not seeing the same volume. So a busy session for me would be maybe 7-8 patients.
Right.
Compare that to any work you do in the NHS.
Well, I'm pushing about, around 15, not including all the admin that's associated around other bits and pieces. So it's I can see that.
So
that makes
just
sense.
The number of decisions you're making in a day is
less. It's completely less. I take it the big one that everyone, we're probably going to get a couple of comments that we haven't mentioned, that out of that 4,000, you've not mentioned CQC. And I know we've done a deep dive video onto this. So how did you get around that?
So because I was using practicing privileges.
Gotcha.
For a start, I'm in Glasgow, so it's actually the HIS, not CQC,
because
it's Scotland.
Apologies.
Which, we've talked about in another video. But the reality is it's the same sort of process in this context, which is that I'm using practicing privileges because I still do work as an NHS GP. I just don't work as much as an NHS GP. So as long as you're on the performers list, which means that you still do the bare minimum that you have to do, it's roughly about 40 sessions a year. For the NHS, it means I can appraise and revalidate and do a lot of other things like market research. That's another video. But the reality is that I'm still able to be on the performers list for the NHS. Therefore, I can use practicing privileges and I don't have to have specific regulatory approval for what I'm doing. I can use the practicing privileges from somebody else's regulatory approval, i.e. the person who's renting me the room.
Gotcha. And I think actually this plan that you're sort of demonstrating, for me, it deals with one of the common myths that I think is floating out there, that actually there's no harm, and it's probably more sensible, as with any of these external incomes, to gradually bring it in rather than just go, right, I'm going to stop my NHS work. Tomorrow I'll be Mr. 8-session private GP. It's like, you've done one session that you're just gradually sort of creeping it in, sort of building it up and up. So can you talk us through then? Okay, so you've spent £4,000. We know we've got potentially CQC that we need to get organised at some point, but you're happy at the moment. What does your first year, 2 years look like to sort of push things forward?
So I really approached it on the basis of let's just actually test the water here and see, is there a market? I mean, is there enough of a market for me to justify doing this at all, even just one session? It was purely a trial test and see in my initial phase. Once I'd realised that I could make it work, then it was just a case of, well, hang on, how much time can I dedicate to doing this, and can I gradually bring down my NHS work and gradually increase the private practice side of things. So I worked it out. I think I only needed to see something like 55 patients to actually break even on setting up. Now, at the start, you don't have a big patient list, you don't have word of mouth, you don't have any sort of brand awareness in the population local to me. But the reality is it doesn't take that long to get going once you start it. 55 patients. So I was probably seeing 2 or 3 patients a session a week. It would have taken me best part of a year to break even, but the reality is that I just started increasing the sessions. So
right. Okay. Makes sense.
the time it took to break even became much less. And and then because you've got more sessions and more availability, more people can book. It's kind of a self-fulfilling cycle.
And clearly,
I had someone from Inverness ring me.
Oh wow! Okay, so you're down in Glasgow, Inverness.
Yeah. So like that's the sort of reach you can get to relatively quickly. I mean, we started this in September 2023.
Wow. Okay, so December 2023, and then you're getting phone calls from what, over 100 miles away to sort of say,
easily.
So sort of like say, can I sort of get booked in? So that costing, like, I've pushed it too far already. How did you, obviously that 55, you clearly got a figure that you are charging your patients. Like, how was that roughly calculated, if you don't mind sort of sharing that?
So you can quickly work out what other people are charging. It doesn't take too long to go on the Spire and Circle websites and find out what a consultation cost is. And if they don't have it clearly written, you can ring them up and ask them. And
good point.
So you can
do your own market research. Yeah,
like any other business, right? If you're going to set up a business, you do some market research.
Yeah.
So it was quite straightforward. I worked out that they were charging around £200 for half an hour, so I charged a little bit less, 179 for half an hour, and then I based my 15-minute appointment on that. So it was a bit more for 15 minutes. It's 99 for 15 minutes, but that was what I was charging at the start to try and make sure that I knew that it was worth my while. So if somebody books a 15-minute appointment, I've only got one 15-minute appointment booked in, I'm still having to pay my £85 for the room.
Yeah.
So I needed to have a reasonable return to justify starting.
So obviously, so with your clinic, you're offering, it's Glasgow ear clinics, you're a GP with specialist interest in ENT. So you looked at an ENT consultant and what they're offering on private, and just not undersold massively, but just enough to be like, yeah, I can't offer that, but enough to get you a starting sort of figure in.
Yeah.
Which makes sense. Yeah. Okay. And then as you say, this is 2023 that you set up from that way.
Yeah.
We're now 2025. I know we've done a longer video sort of talking more about that, how it's your sole clinical or the significant majority of your clinical income, and sort of...
Yes, very much so.
And that's within 3 years? Less. But
that's
again...
about 18 months.
18 months, but as you've sort of ramped that up, it's sort of like meeting that need and testing and adjusting it. So...
Yeah. So we tested it, and I got better at marketing it. Got word of mouth referrals because I'd seen patients and they'd said to other people. And I also was able to increase the amount of time that I was able to offer in the clinic, so I can offer more sessions or more time each day. And as I'm being able to do that, I'm able to increase the different services that I offer. So although I initially started out offering GP with ENT, I now almost offer just as much GP work, to what I would call routine GP work for people who want to just see somebody they couldn't see, and that's absolutely fine. Yeah, I can do that.
Brilliant.
As well as doing the ENT stuff.
Fantastic. So, have you got an email if people want to know more and want to have a chat to you?
Sure, yeah, it's matthew@docsupport.co.uk, and by all means drop me a message and we'll get back in touch.
Brilliant. And what we'll do is below, we'll leave Matthew's email. We'll chuck in I would strongly recommend that you follow Matthew on LinkedIn, because there are these regular webinars where, this is just a short video. They're an hour long in the evening with a good chunk of time to basically answer any burning questions that you've got. If this is something, you don't even have to be, I've tapped in on a couple of ones just out of curiosity. I've got, I'm not planning on going private practice, but it's just interesting to be aware of the other options out there, because people ask these questions. And so it's good to know what information is out there and that we know from there. And that's it.